on what causes disease. Whereas in salutogenesis, the focus is what causes health. Pathogenesis is all about avoiding problems, whereas salutogenesis is about reaching our potential. Pathogenesis is reactive and only working towards the absence of disease. There's disease. How can it be made absent? But salutogenesis is proactive. It says, how can you induce a sense of health, wellness, and well-being? How can you manifest the presence of health? And whereas pathogenesis is against pain or loss, it is against something. Salutogenesis is for something, and that is gain or growth. While pathogenesis prepares one to live, or rather survive, salutogenesis enables us to discover how to live fully. So if you look at this continuum, the spectrum, we go from one end, which is premature death, to the other end, which is high-level wellness, illness to wellness. And in the illness component, we have the treatment paradigm focusing on disability, the symptoms and the signs, whereas the wellness paradigm goes across the whole continuum. It works on awareness, it works on education, it works on growth, and it induces a high level of wellness to manifest. Today I'm talking about yoga, yoga therapy, and modern medicine. And it sounds like East and West. And Rudyard Kipling, he made a statement. He said, oh, East is East and West is West, and never the twain shall meet. Well, he said it a long time ago. But with apologies and sorry, Mr. Kipling, they indeed have met. And how have the East and West met? They have met through yoga. And his most famous character, Mowgli, you can see asanas with Mowgli, which is a beautiful cartoon that you find there. The East-West dichotomy seems to have been overcome in recent times. What is happening is many Eastern traditions have slowly and steadily percolated the healthcare systems worldwide, especially through our mind-body therapies, where the focus is on health promotive, intrinsic connections that exist between the human brain, our mind, our body, and the individual behavior. Well, this is not surprising because what is yoga all about? It's all about integration. So let us go to the UK. And what do we find in the National Health Service? They tell us dozens of scientific trials have been published. And they say that yoga is a safe and effective way to at least increase your physical activity and especially your strength, flexibility, and balance. And they have said that there is some evidence. Because you see, these bodies are very cautious in their statement. They say there's some evidence that regular yoga practice can benefit those with high blood pressure, those with heart disease, those with aches and pains, especially the lower back pain, lumbago, and those who have depression and stress. During the pandemic, depression and stress has become global. And well, yoga has a great role there. Let us go over to the huge continent and to the US of A. And what have they found? The National Center for Complementary and Integrative Health tells us that the use of yoga and meditation, because they keep yoga and meditation separate. For me, they are all one and the same. From 9.5% to 14%, the use of yoga has gone up just in the 5 years. And the use of meditation has gone up by, more than 3 times, nearly 4 times, between 3.5 times in that same 5 years. And they did a study, yoga as a complementary health approach. Why do people practice yoga? And 58%, the majority, is to maintain health and well-being. That is what salutogenesis is all about. Then 22%, because the doctor said do it, 10.5% for musculoskeletal, and 16% for specific medical condition. And what is the number one reason why people use complementary health practices? Back pain. Again, something that's being increased in the COVID pandemic. A 2016 Yoga in America study, it gave the highlights that people start yoga for the sake of flexibility, stress relief, general fitness, to improve overall health and physical fitness. 86% of the practitioners reported a strong sense of mental clarity. 73% that they felt they were strong. And 79% give back to the community. Give back to your community. Share and care with unconditional love. Yoga Seva. It was coming into people even while practicing plastic yoga. Isn't that amazing that even plastic yoga can enable people to want to give back to the communities? Imagine if people practiced platinum golden yoga rather than plastic yoga. It would be 100% giving back, because the more you give, the more comes back. The more you share, the more you grow. The more you love, the more you are loved. The more you respect, the more you are respected. The more grateful you are, the more gratitude comes back to you. Now, just the other day, I Googled yoga therapy on PubMed. PubMed is the gold standard for yoga for research. And 6,205 papers come up for yoga therapy. This was not for yoga, yoga therapy. If I put yoga, it's going to be definitely even more. So many PubMed studies are coming up. Gold standard publications are coming up. But where did this all come, and who should we be grateful to? Our own Professor Madan Mohan sir. Professor Madan Mohan sir has been the pioneer. Now people are talking about it because Yoga Day comes, everybody talks. Yoga, 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 integration, yoga, yoga, yoga in this, yoga in that. Long, long ago, he started the work of integrating yoga while he was at Jipmer. He was a pioneer, a living pioneer, a living inspiration, and we must acknowledge those who have been pioneers. Nowadays, people try to make it sound like they have done it. His legacy of integrating yoga and modern medicine must be acknowledged, respect, gratitude. And in 2008, he brought out a publication on yoga to medical students. This. And how he brought guidance. He was not just an armchair yogi. He is a practical yogi, taking it to the students, right? There have been other this. This is all hocus pocus. This is all artificial imagery. No. Your Annamaya Kosha is your anatomical existence. We all have a physical body. We all have that physical body coming alive through the Pranamaya Kosha. So when you talk to the medical students, the medical professionals, you say the Annamaya Kosha is your anatomical existence. Now they understand it. You have created a language. What is your Pranamaya Kosha? Your physiological existence. What is Manomaya Kosha? Your psychological existence. What is Vijnanamaya Kosha? Your capacity for discernment and metacognition. That is what Vijnanamaya Kosha is. And what is Anandamaya Kosha? Your ability to connect with the society around you, with the world around you, and find a balance in that state of oneness. This is how you talk. If you say, no, Annamaya Kosha, they'll say, what is this? You have to communicate. Very, very important. And that is why this Panchakosha model can be taken right down to your cells. And the other day I was presenting this and was so happy when the Dean of Research of Manipal University said that he enjoyed this concept, and he said, I'm a cell biologist. So I said, if a cell biologist loves this concept, then the track is good. So now I'm more confident to talk about this. Every cell has a Panchakosha. What is the Panchakosha of the cell? You have the structural existence. A cell has a structure, cell structure that you study in anatomy. It is called Annamaya Kosha of the cell. Every cell is functioning. That is what we learn in physiology and biochemistry. That is the Pranamaya Kosha of the cell. We then have the Manomaya Kosha of the cell. It is the cellular memory. The cell knows what to do, how to do it. But then The cell also has a Vijnanamaya kosha. It has intelligent feedback mechanisms. When it should work more, when it should work less, it is having the discernment when to do more, when to do less. It is making a choice. Vijnanamaya kosha of the cell and Anandamaya kosha of the cell is where every cell in your body is in tune with all other cells in your body. And that oneness between all the cells where they understand that all the trillions of cells are part of the greater you. That is the Anandamaya kosha of the cell. Similarly, there is a concept in psychology called flow. And flow implies getting into a state where you are at your peak performance. You are in that what we would call a state of dhyanam and even a state of minor state of samadhi. There is no you, but you are doing it at the optimal level of functioning. The most efficient optimal level of functioning, but you are not there. The ego has got separated at that point. You are there, but you are not there. You are doing it, but you are not doing it. It's a beautiful moment. It's called flow, the flow channel. And the flow channel depends on two factors. One is your skill, and second is the challenge. So, whenever you get a challenge, don't get disheartened because the challenge is testing your skills. And you have a chance to develop the skill because if your skills are low and challenges are more, you will have anxiety. You can see this corner here. Skills are low, challenges are high, you go into anxiety up here. You see this part? And if your skills are high and the challenge is low, you get into boredom. So too much of skill with no challenge is boredom. Too much of challenge without skill is anxiety. So what do you need to do? You need to develop your skills and put yourself out there to be challenged so that you start to constantly grow into this flow channel. What is this flow channel? It is what the Bhagavad Gita, Yogeshwara Krishna calls Karmasu Kaushalam. Yoga Karmasu Kaushalam. You come into that skillful state where you're doing without doing. And in that moment, you go into that flow channel. Similarly, the concept in modern medicine we have of sympathetic, parasympathetic. Fight or flight is the sympathetic. Rest and digest is the parasympathetic. And you want autonomic balance. Because the rest and digest is where you will rehabilitate and heal. And this is why relaxation is the key to healing. Relaxation is an essential prerequisite for healing. And we cannot heal if we are stressed. Very important message. We cannot heal when we are stressed. And so conscious relaxation, mindful relaxation, the Jnana Yoga Kriyas that are there as part of the Rishi culture tradition. You can go to Sangeeta's YouTube channel and you can see all these beautiful guided Jnana Yoga Kriyas being guided there that you can practice to facilitate and educe from within a relaxation response. And when the relaxation response kicks in, you start to enhance self-healing. And this is why yoga's greatest contribution to modern healthcare will be in the field of non-drug, non-pharmaceutical, non-pharmacological relaxation, which is cost-effective and safe. Another important concept, as a young medical student, luckily I had the yoga behind me. So when I started to learn about sinus arrhythmia, it was a beautiful concept. What is sinus arrhythmia? Whenever you breathe in, your heart rate becomes faster. Whenever you breathe out, your heart rate becomes slower. Alteration of the heart rate in response to your breathing cycle. Inspiration, sympathetic recruitment, heart rate becomes faster. Expiration, parasympathetic recruitment, heart rate starts to go down. Now you say, sir, this is not a class on physiology. Well, this is a class on metaphysiology. So what we are saying is that in pranayama we say, let us learn to breathe out for a longer duration. Because normally inspiration is active, expiration is passive. In pranayama, which is an essential component of yoga, what we are doing is facilitating active exhalation and prolonged exhalation. And you say, okay, breathe in for 4 count, breathe out for 12 counts. So you say, and then you start breathing out. And they say, sir, not possible, sir, very difficult. Breathing out longer is difficult. You know how you can do that? Add sound to it. That is where the power of Nada Yoga comes in. The moment you add sound to the equation, you can breathe out for 3 times, 4 times, 6 times the inhalation. Suddenly your exhalation can become smooth, prolonged, and extended. So, for example, if I were to breathe in and then I breathe out, you have a prolonged exhalation, much, much easier. And what is happening? Now you have the side benefit of the sound also, because the sound is vibration. And especially when you are doing, because humming enhances endogenous nitric oxide that relaxes your blood vasculature and enhances the tissue perfusion. It clears your sinuses. It enhances your immunity. So you add it. So we prolong the exhalation. When you prolong the exhalation, what's happening? You're bringing the heart rate down. Now, when you bring your heart rate down, what is happening? In the cardiac cycle, you have contraction of the heart and relaxation of the heart. Systole and diastole. Now, what is happening? Diastole period is important because the heart is receiving the blood from the whole body and now it pumps it out in systole. But what is happening if your heart rate becomes faster and faster? There is less time for the diastole. But if your heart rate becomes slower, there is more time for diastole. And what happens is when you enhance diastole phase, your heart can fill more efficiently so that the next time it pumps out, your ejection fraction is better. You are making your heart slower but more efficient. And what does this also give you? It is in the ventricle that, when the diastole phase is occurring in the ventricle, that is where the heart is supplying itself. Your heart supplies the whole body during systole and supplies itself during diastole. Now, if your heart rate becomes faster and faster, what is being compromised? Your diastole. So what is being compromised? Your coronary artery circulation. What is being compromised is your health of your heart. So as you extend the exhalation, you are reducing the heart rate, lengthening diastole phase, enhancing coronary perfusion. And this is an amazing place where this knowledge comes together. How do you breathe? Most people don't even think of the breathing. And they think that lungs are only on the front, pasted on the front, like a t-shirt. People don't understand you can breathe to the side of your lungs, and nobody understands you can breathe into the back of your lungs, even yoga teachers and therapists. What do? Go and sit behind somebody or stand behind them, put your hands on the back, okay? And then tell them, try to breathe and move my hands. Suddenly they start to realize, oh my God, I can use the power of my mind to breathe into the back of my lungs. And suddenly you open up a new part of their whole physiology. This is called bronchopulmonary segments. It is called Vibhaga Pranayama in yoga. This is where we have to understand Vibhaga Pranayama is utilizing all the bronchopulmonary segments to the best of their capacity, so that even if you get afflicted by COVID and other respiratory conditions, whatever it may be, you have such a huge level of function that even if you lose 50% of your capacity, you are still normal. But people are already at only 10% of the capacity, and then they lose that. No wonder our saturation goes down, and then we end up in ICUs. Another concept, yoga and modern medicine. You go and say, there are pancha prana vayus. The doctor says, what is that nonsense? You say, well, let me express it in a different way. We talk about an energy called prana. It's one of the energies, and this is the function energy that enables the process of respiration. Respiration is a function. What is the energy that enables respiration to occur? In yoga, we call it prana. Communication is a function. What is the energy that enables communication? Udana. Circulation is a function. What is the energy behind it? We call it dhyana. Digestion requires energy. Where does that come from? We call it samana. And excretion is an important function. Otherwise, you get clogged up with all your mala and become toxic. Excretion is a function and it is enabled by the energy called apana. Suddenly, you are speaking a common language. If you go in and say to a doctor, sir, that patient's udana is not working, he will kick you out of his clinic. You have to tell him, according to the yoga diagnosis and assessment, it is the udana not working. In your parlance, it is an error in communication. And yoga says if you can set the energy balance right, you are going to help the function to improve. You improve the function by enhancing the energy. This is how we bring it together. And the most important message is psychoneuroimmunology. Because this is what yoga talks about. How the mind and emotions and that beyond it can then affect your nervous system. From the nervous system, it then affects the body, and how your nervous system, endocrine system, immune system are all interconnected. And this, the yogis used to call it chakras. Now you go and tell a medical doctor, oh, your chakras are not working, they'll kick you out because it sounds like some quackery. Sounds hocus and pocus. But you say, sir, in our system, we call it chakra. Chakra is energy. Now that energy, when it is slowed down, it becomes mass. And that mass is what in medicine we call the endocrine glands. The endocrine glands are the mass, chakras are the energy. And Albert Einstein understood it in his equation, E is equal to mc square. So they say yes, but that's the square of the speed of light. We say yes, because the fastest thing in this universe is the power of the mind. The mind is even faster than light. Light is just getting out of my room now. My mind is already on the moon. Light is going to take a long time to get there, okay? My mind is already on the moon. My mind is already in New York. But light is still sitting here in Pondicherry. That is the power of the mind. And that is why where the mind goes, the energy flows. Because what you are doing, you are focusing the mind. This is the correlation we have to work on. Because otherwise what will happen is you will never, the east will remain east, west will remain west, and there will never be any coming together. The fight today being projected between yoga and modern medicine, it is a totally irrelevant fight. There's no fight. Yoga and modern medicine can work together. That is the gist of my talk today. Because yoga says you have to stop identifying with your disease. We identify with our suffering, my diabetes. And people often, you ask them, Namaste, who are you? They say, I'm a diabetic. Even they don't tell you the name, they say their disease condition, they've identified so much with it. Yoga says as long as they have identified with the disease, you cannot get rid of the disease. You have to stop identifying. And that is what is dukkha samyoga viyogam, yoga sangeetam, according to the Bhagavad Gita. Now, when I talk about yoga therapy, we must remember yoga therapy without yoga is no longer yoga therapy. Yoga therapy without yoga is therapy. And my father used to say modern yoga therapy is just Western physiotherapy in Indian clothes. And we have to be careful we don't let that happen. Yoga is an essential component of yoga therapy. Yoga therapy without yoga is not yoga therapy. And the cause of disease, according to yoga therapy, is Dvaitam, duality. A movement away from a state of ease into disease. Tridosha in the balance, imbalance. The Dwadasha prana, I told you these energies, what is the imbalance that you have to rectify? And the psychosomatic, non-psychosomatic disorders that have been talked about by the Yoga Vashishta 5,000 years ago. But what happens? 5,000 years ago, Yoga Vasishta talked about it. But just in 1979, you have Antonovsky talking about the same thing. He says the stressor comes in, Adi comes in. Now the Adi, depending on how you perceive it, can go down the pathogenic pathway where you go into breakdown and you go down into disease and death. But if you choose the right attitude towards the stressor, you now go up the salutogenic pathway and you grow in spirit into a healthier you. So the same stressor can either kill you or make you. That is the message that is being given here. And we need to understand yoga is an experiential science. Dr. B. Ramamurthy.
Sorry for the disturbance. Sorry, sir. We muted her. We can continue, sir.
If other people have more important things to say, they can say it.
Sorry.
The basic courtesy in any meeting is to mute while the speaker is speaking. Basic courtesy.
Yes, sorry, sir.
Scientific evidence. This is what everybody wants these days. The new religion is science. It indicates yoga has promotive, preventive, and sometimes curative potential. It is a safe, non-pharmacological therapy and is an effective lifestyle adjuvant to reduce drug dosage and improve quality of life in patients. These are the main points that need to be brought in when you want to bring yoga and modern medicine together. Otherwise, it's not going to happen. We are just going to be on the fringes. In preventing and managing psychosomatic and stress-related disorders, name the disorder, it is there in the list. Reduce or eliminate drug dosage and dependence in, again, virtually every disorder you can think about. And this is why the key message here, yoga therapists must work in tandem with the medical doctors with managing patients on medical treatment. You don't say, I am the yoga therapist, you don't need treatment, come to me, I'll save you. That is pure and pure unadulterated quackery. And I condemn such approaches. We need to understand that every therapy has a role to play. And today, the key message is integration, coming together. Traditional, complementary, integrative medicine is the need of the hour. Not saying, oh, I will do it all. We need to understand we have to work together. Collaboration, integration is the key word we need to take forward. Because long ago, Plato, even he said it. The treatment of the part, which has become super specialty, super duper specialties, treatment of the part and the subpart shouldn't be attempted without a treatment of the entirety. We are losing the picture of the wholesomeness of the human being. The treatment of the body without treating the mind and soul. Please understand, he said mind and soul is a useless waste of time. Yoga gives us the tools, the philosophy, the practices to deal with the mind and also connect to the soul. This is where modern medicine can work with the body, to some extent with the mind. But more than that, we are a blind man in a dark room looking for a black cat that doesn't exist. That's what happens. We need something else. We need to be enhanced. And that is why the strengths of yoga help overcome the limitations of modern medicine. The strengths of modern medicine help us overcome the limitations of yoga therapy. And hence you have eliminated the limitations and enhanced the strengths of both systems for the sake of patient. The most important person in healthcare is the patient. Don't forget that. The most important person in an educational institute is the student. Don't forget that. Everything else comes second. But we are stuck up with everything else. Yoga can come into the modern medical setting through lifestyle modifications, rehabilitation, coping skills, healthy diet, relaxation. It reduces the expenditure, anti-aging. It can work in psychotherapy with the mind and beyond. Women's health, a very important place where yoga can play an incredible role. And the research component in basic and applied scientific research. Because yoga says it starts with the mind, comes down through the pranamaya kosha, the energy, into the body. So you need to retrace your way. You need to bring the body, mind, and the soul together. Those that have disconnected have to be reconnected. And otherwise, we go through the psychic, psychosomatics, somatic and organic phases, and the disease will come down. And before you know, it is an organic stage where then yoga has a very minimal role. In the psychic and psychosomatic stage, yoga can play an effective role and deal with what used to be called by my dear Professor Seduraman sir, medically unexplained symptoms, MUS, which is about half of the reason why people come to hospitals with medically unexplained symptoms. Those are the people who should first come to yoga. If yoga cannot help them, then you start other therapies because you have to deal with it. Otherwise, what happens? You go from every specialist to every other specialist. You do every test in the lab, and finally you find something which has nothing to do with where you started. Medically unexplained symptoms is a huge issue in modern healthcare. Yoga therapy can play a role there as a first level for psychic and psychosomatic. Yoga can help modify the coronary risk factors and even reverse heart disease, as has been shown by Dean Ornish. Great potential in children with intellectual disabilities, metabolic syndrome, the big pandemic that we are not talking about, and in psychiatry, by reducing the perceived stress, can bring about so many changes. The top three conditions addressed by yoga interventions in recent times: mental health, cardiovascular disease, and respiratory disease. And these are the three places where yoga can come into the modern health setting and be very effective as a bridge. Because yoga works on body, mind, spirit, creating healing and restoring function of the body, creating healing and reducing suffering in the mind, reducing suffering and creating community with the spirit. And suddenly, the three domains of body, mind, and spirit, you are having tools to deal with it. You are having concepts to deal with it. You are having a philosophy of life to deal with it. But we need to understand, if we don't do root cause analysis and treatment, if we don't look at the individual psychosomatic disassociation and the misconceived self-identity, avidya, we are not practicing yoga chikitsa. Managing and suppressing the manifest symptoms without understanding the root cause, it is just yogopathy. And now I'm 12 years into my writing on this. My first paper on this was in 2009. I have been talking about it, of course, since about 2003 and 4. 2009, I wrote about it for the first time. 12 years I've been talking about it. It has become part of the yoga therapy parlance. Yogopathy is the symptomatic management using yoga techniques. We don't, that may be useful sometimes, but it's not yoga chikitsa if you don't go to the wholesome approach. Yoga chikitsa is based on salitogenesis. Yogopathy is based on pathogenesis. And we need to move from yogopathy to yoga chikitsa, from pathogenesis to salitogenesis, if we want yoga to be part of the medical system. That leap upstream from pathogenic to salutogenic, there has to be that leap, and it changes so that we improve our natural and built environment into an optimal healing environment, as Seduraman sir called it. We need to induce and manifest health. We have to have a culture of active health, and we have to develop our health assets. We have to look at the lifestyle, achar, vichar, ahar, vihar, and vyavahar, which is where yoga is the best lifestyle ever developed. It is a lifestyle that can be an antidote to all the lifestyle disorders that are there, all the non-communicable disorders. So once you have the disorder, the antidote is yogic lifestyle. Before you have the disorder, the vaccine is the yogic lifestyle. So yoga lifestyle becomes a vaccine against the lifestyle disorders. It could be a vaccine as a prevention, primary prevention, and it can also be an antidote as secondary, tertiary, and Bijlani sir brought it in, quaternary prevention also. When we look at the definition of health from the WHO, accepted by the modern medical community, we have the 4 domains: physical, mental, social, and spiritual. And well, yoga says, well, we have Ashtanga Yoga of Maharishi Patanjali. What are the Yama Niyama? They are dealing with enhancing social health. You understand yourself better, you understand others better, social health parameters, indicators come up. Through the asana and pranayama, you are enhancing your physical health by bringing a state of homeostatic equilibrium. Autonomic balance is coming in. Through pratyahara and dharana, by taking your senses inward and starting to contemplate and focus, the mental health. And of course, dhyana and samadhi, enhancing the spiritual health aspect. So all the 4 domains that the World Health Organization talks about, they are addressed by Ashtanga Yoga of Maharishi Patanjali. Hence, there's no dichotomy, there's no fight. IMA and IYA can coexist because they coexist in me. I'm both a proud member of Indian Yoga Association and Indian Medical Association. Both they coexist hand in hand together for the sake of humanity, because we can enhance each other's capabilities. We can enhance. You have this big picture, panoramic view of yoga. Yoga gives you the panoramic view, the big picture. Modern medicine gives you the microscopic view. You can see the smallest of the small, anima, the atoms. And what happens when you can have the panoramic view and also the microscopic view? Your perspective will be holistic. When you have the holistic perspective, you will be able to address the other human being, understand the cause of the dukkha, the suffering, and help mitigate the dukkha to enable them to move from dukkha to sukha, from disease to ease, from duality to oneness, from illness to wellness. That is what we can do when we have this picture. And that is why they naturally go together. But I must warn you before I end today. It doesn't matter how many resources you have. If you don't know how to use them, it will never be enough. And this guy has all these ladders. He just needs one ladder and he can cross that wall. He can overcome that obstacle. He doesn't know how to use that ladder. And hence he has all these ladders piled up at the bottom and still is not reaching the wall. I think this is where we need to realize that it's not just enough to have the yoga, not enough to have modern medicine. We need to know the appropriate usage, when to use. Idam eval porul, they say in Tamil culture. We should understand the right time for using the right technique. In a heart attack, you don't say, I will teach you Kapalbhati. But in chronic asthma, you can say, I'll teach you Kapalbhati. It will be very effective. Because in COPD and chronic asthma, the medicine is not going to stop the deterioration. So there Kapalabhati will play a role, but not in an acute heart attack. Not when somebody is having status epilepticus. You don't say, I'll teach you Kaya Kriya relaxation. No, you have to know what is the place for each therapy. What is the place for the techniques and how they can enhance. Remember, I said the strength of yoga overcomes the limitation of modern medicine. The strength of modern medicine overcomes the limitation of yoga as a therapy. And hence, you have got rid of both the limitations. And you only have now the strength to work with. But we have to know how to use it. We should be aware that these tools are there and how to use them. So the need of the hour is a symbiotic relationship. Symbiosis is when both sides benefit from it. Parasitic is when only one benefits and harms the other. It is a symbiotic relationship of modern medicine and yoga. And we need living human bridges. We need people who are in yoga, people who are in medicine, who understand both the sciences so that they can bridge it. And all of you there at Alpade Bedu Medical College and Sri Vinayaka Missions, you are blessed that the director himself is a living bridge, Madan Mohan sir. And then you have my dear Bala there, who is again a living bridge. This is what we need today. We need to have more living bridges, combining the best of the East and the best of the West for the sake of humanity itself. We need to have wholesomeness and salutogenesis. And we need to move from dukkham to sukham. This is why Swamiji tells us, your health and happiness are your birthright. It is only through yoga you can know the true health and happiness. That is where yoga has to come in. And a very beautiful slide from my dear Dr. Meena, where she has talked about this movement that has to be there. We have to move from the bhoga marga of being caught up in the world to the yoga marga. We have to move from the prayer marga of enjoyment and always trying to get caught up with things to the shreya marga, the noble path. We need to move from dukkham, suffering, to sukham, ease. From pathogenesis to salatogenesis. From dis-ease to ease. From illness to wellness. From devolution to evolution. From disassociation, not only disassociation, from a state where we are in pieces, we have become piecemeal. We human beings have become piecemeal human beings. We have to move towards a state of unified humanity. And from Dvaitam or duality and dichotomy to a state of oneness, Advaitam. How do we go on this journey? What is the defining path? That path is yoga. And with this, I conclude my session today, offering my gratitude to the Center for Yogic Sciences, the Alpade Veedu Medical College, and the Sri Vinayaka Missions for this opportunity to be with all of you, to share my thoughts with all of you today. A great pleasure to be with you and share. And thank you so much for being part of today and enabling this to manifest.
Thank you, sir. Thank you very much for the wonderful enlightenment. Wherever you, wherever, whenever, whatever you speak, that is a word of wisdom, enlightenment. And it just, again, it's enlightening sessions for us today. The main aim of this talk, integrating yoga in modern medicine, is because of the recent disintegration happened between yoga and the allopathy system. So I thought you are the right person to address this issue and solve the disintegration to integrate. And you have many points you have clarified, and the integration between yoga and medicine, it's happening there in both cited SBV and ABMC in many places of India. It's happening there. And thank you, sir, for this wonderful knowledge. Again, the enlightenment you shared.
I
Sir,
would
I
like
have
to
one.
I would like